My next guest has been a pharmacist for 30 years and is the only pharmacist in Congress. He thinks the coronavirus is the wake-up call America needs to bring back the pharmaceutical supply chain to the United States. Welcome, Congressman Earl Buddy Carter, a Georgia Republican, up for election. It's a few days again, re-election. Buddy, thank you for taking time to talk to us about this. I just said it. You think that this ought to be a wake-up call. What needles do we need to move to make sure that America has the supply chain, something it can trust to deal with this pandemic?
Well, first of all, thank you for having me. And to your point, I've always said there's a difference in knowing something and realizing something. I think we've known for quite a while that we were too dependent on other countries for our pharmaceutical needs. But during this pandemic, we've realized it. And having realized it means that we have to do something about it. And one of the things that we are proposing and that I have legislation is called the MAID Act. It's Manufacturing Active Pharmaceutical Ingredients, Drugs, and Excipients in the U.S. And what we're trying to do is to attract some of these pharmaceutical manufacturers that are located out of our country back into our country. You know that 90% of all the ibuprofen in the world is made in China. 90% of our antibiotics come from foreign countries. That's not a good situation for us to be in. I'm reminded of the late 70s when we realized that we were dependent on the Middle East for our energy needs, and we realized that we needed to have energy independence, and we achieved that. The same thing can be said now. We realized that we're too dependent on foreign countries for our pharmaceutical needs, and we need to do something about it. We need to have pharmaceutical independence. That's why with this legislation, what I'm trying to do is to attract those companies to come back to America, to try to incentivize them and to repatriate them back to America through the use of opportunity zones. You'll remember that opportunity zones were created through the Tax Cuts and Jobs Act, and that will actually be a tax credit that these companies can get if they will locate their manufacturing facilities in these areas. We use other incentives as well, tax incentives, not the least of which is trying to browbeat them and appeal to their patriotism that we need you to come back in America. That's very important. Pharmaceutical independence, not only pharmaceutical independence, but also with PPE. We're too dependent on these foreign countries for our PPE, for our personal protective equipment. We need to make sure we're doing manufacturing here in America with that, with PPE as well.
Well, Congressman, one of the interesting things as I've kind of delved into this, and I'm glad you made a distinction between PPE and the kind of the pharmaceutical side. The PPEs, we clearly saw, law of the jungle. But if you kind of look and you peel back, I think there was a sense of anxiety and crisis about pharmaceuticals, about dependence. But when you got into it, I can't find anywhere where they weren't delivered, that the supply chain largely worked through this time. And I'm just wondering if my bearings are off somewhat, because and I know that you're working on what our national stockpile of this should be and how we should look at what the key medicines and therapies ought to be. But I guess when we looked at the actual experience, did things hold together or not?
Well, certainly we had threats, and fortunately they didn't come to fruition, but we had threats from China. It said, yeah, we're glad to send you this medication. We're going to use what we have to use first, and if there's anything left over, then we'll send it to you. That's not the kind of situation we need to be in. That's not in the best interest of the health care of our citizens, nor is it in the best interest of our national defense. That's just a situation that we should avoid and we can avoid. We do need to get pharmaceutical manufacturers. The same thing with the PPE. You've seen, yes, we've been able to basically get everything that we need, but at what price? The price has gone up enormously. We've heard of price gouging that has been happening from foreign countries, and that's again why we need to address this.
I've talked to leaders in industry, the pharmaceutical and therapeutics manufacturers, and I think they're interested in kind of partnering with government on things like looking at the strategic stockpile, like doing this. But they said in terms of onshoring or re-onshoring some of this capacity that's moved abroad, it requires a kind of whole of economy system. You've got to have long-term purchasing. You've got to have regulatory changes. You mentioned opportunity zones. And I guess my question to you, is there a place in our government that's thinking holistically about that environment? Because they said if it's done piecemeal, it won't work.
Well, you're absolutely right. We've got to make it worth their while. We understand that. One thing that we have trouble competing with is labor costs. And there are going to have to be other incentives in there to make sure that we cover that part of it. And that's why it's important that it is holistic, as you point out. We can't piecemeal this to make it work. And we understand that. That's why this legislation that I've introduced, again, addresses all of those different things. And also, there are some pharmaceutical manufacturers that are located here in the United States already. And a lot of them have been asking the question, well, what about me? Am I going to get incentives as well? Yes, there'll be incentives in there to attract them to remain here in America. So that's very important and certainly something we have considered. If I could talk just a second about the stockpile, because you've mentioned that a couple of times. I also have two pieces of legislation that I think are very important to address our stockpile. We all know that we've got a federal stockpile, a federal strategic stockpile, but we've recognized that we've been too dependent on that. So I've got legislation, and it is bipartisan legislation, by the way, that I'm co-sponsoring along with Lisa Rochester Blunt from Delaware, a Democrat, to address our state strategic stockpiles. And what this is a matching grant. It's a dollar-for-dollar grant to encourage states to have their own stockpile. What we found out during this pandemic was that we were all too dependent on the national stockpile and that states didn't have what they should have had in place. Well, this is a pilot program, as I say, that will offer grants to encourage states to have their own stockpiles. That's very important. That'll help us be even better prepared for the next time. Another bill I want to tell you about, again, I'm co-sponsoring with Representative Rochester, is the essential medicine stockpile. And what this does is that, 90% of all the drugs that are used are generic drugs. And instead of waiting till we have a shortage of a generic drug, and then stockpiling it, we actually create the essential medicines that we know we're going to need. And again, this is a pilot program, a 3-year pilot program, whereas we create this national stockpile of essential medicines, and we utilize the ideas that are being currently utilized in the private sector of perpetual inventories and making sure that we have an inventory of these essential medicines so that if there is a shortage at any given time, we'll be able to have them on hand for our citizens. That's very important. And again, by using that perpetual inventory, we can guard against a lot of it going out of date and being wasted. I can remember when I was in the Georgia State Legislature in the state Senate, and we went through the bird flu, and we bought millions of dollars worth of Tamiflu to make sure, and it was the right decision back then, but to make sure that we had it for our citizens. It ended up going out of date, and we didn't have to use it, which was a good thing. But right. We ended up just wasting it. Well, through the new policies that we can get from and the new procedures that we can get from the private sector using perpetual inventory, we can avoid that.
I know we've got a question from the audit committee, but just want to squeeze one more in. I know your role as a pharmacist. Now, I may have this wrong, but in my mind, pharmacists are kind of like, in some ways, the canary in the coal mine. They know what the inflow outflow is. Are there things that we should know about the pharmacists and what role they can play, or amping up their role in terms of alerts and what the flow and need is out there of various key pharmaceuticals?
Well, that's a great question, because pharmacists are the most accessible healthcare professionals in America. 95% of all Americans live within 5 miles of a pharmacist. And I've felt for a long time that we're not utilizing pharmacists in particular, but a number of healthcare professionals to the top of their license. And I've discussed this with Dr. Adams, with the Department of Public Health, with Secretary Azar, with HHS, Administrator Verma, and they all agree we need to be utilizing these pharmacists, not only in situations as you described where we see a shortage of different drugs and we can warn about it, but also as we're going through this COVID-19 pandemic, being able to test for this, being able to administer the vaccines. Most people are getting their vaccines from a pharmacy now, from a pharmacist. And We need to be able to administer the COVID-19 vaccine. That's going to help us to get it out to the people as quickly as possible and as safely as possible.
Well, thank you for that. We've been taking questions from the audience, and we have one now from Buddy. Buddy?
I'm Kevin Donnelly, CEO of TCPI in Chicago. What's the appetite of industry, providers, and the current and potential administration for the added costs and challenges of onshoring more of our pharmaceutical supply chain?
So, great question. Question is, are we willing to pay for it?
Well, that is a great question. And, you know, I don't think there's, the question is, are we willing to pay for it? We have to pay for it. We've got to be prepared for this. And I think that we all agree that this is necessary and that in order to attract these companies back to America, we've got to be competitive. These are private companies, and the primary reason they went offshore in the first place was financial incentives, whether it be lower manufacturing costs, lower labor costs, or whatever it is. We in America, we're going to have to bite the bullet, and we're just going to have to step up to the plate and do what we have to do. I think we recognize that now.
Buddy, I know I follow you on Twitter, so I know that you are, right now, you've signed up for a vaccine trial, and you've said you're going to sign up, you believe we're going to come up with a safe and effective vaccine, and, I just want to wish you well in that. I hope it goes well, because I really like folks that stand up. It's an important time. So how's it going so far?
Well, so far it's going very well, and I did start and had my first dose, and in about 3 weeks I'll get my second dose. I don't know whether it's a placebo or the real thing. The doctor doesn't know. The staff doesn't know. None of it's a double-blind study. Only the number on the vial, whoever's got that key, will know whether it's a placebo or the vaccine. But I keep a diary, a daily diary of symptoms, of how I'm feeling that day, what my temperature is. Listen, I believe that it's important as a member of the healthcare profession, as a member of Congress, for me to put my money where my mouth is. And that's why I'm very confident that we're going to have a safe and effective vaccine, so confident that I'm willing to go through the process myself.
Well, if your blood pressure and temperature went up right now, you can blame in your journal Steve Clemons of the Hill. But Representative Buddy Carter, thank you so much for joining us. I know you've got a lot on your plate right now with the election just around the corner. So thanks for joining us.
Thank you.